And nurses are in crisis due to the perfect storm of the pandemic, staffing shortages, and burnout. Now, as the backbone of our healthcare system, the repercussions of the nursing shortage could negatively impact the care, or lack thereof, provided to communities across the nation. According to one survey of 10,000 nurses published by NurseGrid last September, 92% of nurses are worried about the shortage. 4 out of 10 nurses plan to leave the field by the end of this year. Here to provide insight on exactly what nurses are going through is Wendy Garvin. She's a nurse practitioner and founder of the Nurse Wellness Mentorship. Welcome to the program, Wendy. How would you describe the current mental state of nurses?
Yes, nurses are not doing well. Nurses are stressed, burnt out, and the shortage is just adding to that. So, as you know, the nursing shortage and stress and burnout, it's not new for nursing, right? So last year when the pandemic hit, we didn't have the capacity or reserves to deal with that. So it just really increased the nursing shortage and amplified the stress and burnout that we are experiencing at the bedside.